All right, can everyone hear me?
Hi, Brian. This is Jen. I can hear you just fine.
Okay, cool. Good morning and welcome to today's webinar, New Year, New Administration, What's in Store for Healthcare. For Q&A purposes, you can ask a question at any time during the webinar today by typing in the question pane on your GoToWebinar toolbar. All questions will be addressed at the conclusion of the webinar as time permits. After the webinar, you will receive an email with a PDF copy of the slides presented today and the necessary handouts for comments. Our speakers today will be Nicole Russell, Manager of Government Affairs with NCPDP, and Jennifer Steger, Director of Operations and Government Affairs for Horizon Government Affairs. And I will now turn today's presentation over to Nicole.
Hi, Brian. It's Jen. I actually think I'm going to start off with the next slide, the political state of play. For those of you who don't know Horizon Government Affairs, Horizon Government Affairs acts as a consultant with NCPDP primarily on the Advocacy initiative. I want to say thank you to NCPDP for including me in the webinar today, and I'm excited to be here with everybody to talk about healthcare in this new time with the new Congress and the new administration. A couple of items that I wanted to mention at the outset. As with all things in politics and policy, it's all very fluid and can change very rapidly. Also, I wanted to mention that while the slides will be sent around, both my and Nicole's comments are for off-the-record background purposes. So we can move into the political state of play, and to start things off, we thought a little bit of level setting would be helpful. We all know there were promises made on all levels by both parties last fall on the campaign trail, and elected officials will need to work to keep those while proving an appetite to govern and looking forward to the next election cycle or two. As we know, the 2018-2020 elections will have a lot to do with shaping the actions of both parties, even now as we just got off the last election cycle. The entire House is up for re-election every 2 years, and in 2018, a third of the Senate will also be up for re-election, including 23 seats currently held by Democrats, 8 seats currently held by Republicans, and 2 seats currently held by independents. So those independents do caucus with the Democrats. There are also 36 state governorships up for re-election in 2018. For Congress, that means, and on the GOP side, they need to manage expectations while pushing policy where there is enough consensus to do so, which flows directly into proving that they're able to govern as the majority party in the future. We'll talk a little bit later about some of the must-pass pieces of legislation and deadlines coming up this year that will need to pass in order to keep the federal government up and running. On the Democratic side, much the same as with past minority parties, the message of party unity will be recurring and very important. A prime example of this is the unified voice of opposition to the American Health Care Act last week, and in the past and specifically last week. As we look to the administration, there have been some early, what we characterize as missteps that have complicated efforts on key priorities that they had identified. One key well-known example is the rollout of the original travel executive order and immigration, and how that will affect immigration policy down the road. Much as congressional Republicans are focused on proving an ability to govern, the administration is as well, and is very focused on demonstrating action on their priorities, as well as calculating the results and how those actions all played out. This is also, public opinion is also proving to be an important part of the current political environment. There's an entire industry based on polling, public opinion trends, how that translates to policy, but there's an expectation that this administration is extremely concerned with public opinion. I think Nicole is going to talk about a little bit more about the administration and President Trump's budget on the next slide. So I'll turn it over to her.
Thanks, Jen. One of the things that are in play right now is the budget, as Jen just mentioned. The president did release a blueprint of his budget for next year. It's referred to as the skinny budget because it's merely a blueprint, and it doesn't include a lot of details yet. Those will be forthcoming in the next few months. Basically, what was outlined in this blueprint is that any agency not related to defense will be cut. The 3 agencies that have direct influence on defense operations, including the VA, are the only ones that received additional funding, and this is for fiscal year 18. So this slide focuses on the budget outline for the Department of Health and Human Services, which would receive a $15 billion cut, which is approximately 18% of its current funding level. One of the biggest cuts comes to the National Institute of Health at nearly $6 million. This is one that has received a lot of opposition from both Congress and the industry, and it's receiving the opposition from both Republicans and Democrats. If you remember, Congress authorized more funding for the NIH to implement provisions that were included in the 21st Century Cures Bill that was signed into law last year, and that was a bipartisan measure. The budget would also reorganize and roll the Agency for Healthcare Research and Quality under the NIH, which would in turn have a negative effect on the AHRQ's budget needs. This is, again, receiving some opposition because the AHRQ has become increasingly more important as we move towards a value-based reimbursement system that is tied to quality measures. This was another bipartisan measure, the MACR bill, that was signed into law last year. So those are 2 controversial items that were included in the HHS budget, and HHS Secretary Tom Price is testifying today before the House Appropriations Committee, and we can expect to have some questions directed for him stemming from those 2 provisions. The budget blueprint did include an increase in the amount of fees that the Food and Drug Administration will collect from drug manufacturers. So it increases the prescription drug user fees by $2 million. This is essentially about twice as much as what they will pay in 2017. So what the budget outline didn't specify is if the increase would be evenly spread out amongst manufacturers or if it will be directed into a particular area. The Trump administration has openly criticized the FDA for its slow response to approving new drugs. This is reportedly their attempt to speed up those efforts. The budget also includes an increase of about $500 million to fight the opioid epidemic. This is a nod that the White House remains committed to implementing new strategies to solve the issues. This is very good news, and I'll talk more about that a little bit later in the presentation as well. And lastly, I wanted to just outline that the blueprint does include $70 million additional dollars to support the Healthcare Fraud and Abuse Control Task Force. The administration says that this recovers about $5 for every $1 spent on the program, and so they want to continue to beef up that program. Next slide, please. So this slide outlines the budget process and what will be happening over the course of the next few months. Traditionally, full budget details are made public in May. So what I covered on the last slide was just an outline of what Trump has proposed for fiscal year 2018. Full details should be made public, or traditionally are made public in May. Right now, Congress needs to focus on its spending measures for fiscal year 17. The current spending measures are set to expire on April 28th. If you recall, last year Congress voted to pass a continuing resolution to keep spending levels at the same level that they were for fiscal year 16 through the election and transition period. So that deadline is coming up, and if funding bills are not passed, we could potentially face another government shutdown. Reportedly, both the House and Senate are making progress in preparing an omnibus to address this. Just within this past week, President Trump sent a memo to appropriators in the House and Senate outlining that he wants to cut about $18 billion in the 2017 fiscal year budget. So this is not what I talked about on the last slide. This is for 2017. And that includes $2 billion from the National Institutes of Health and the AHRQ. So Congress has indicated that it's too late to make that type of a cut. It's unknown at this point if a spending measure reaches the president's desk that doesn't include the cuts that he outlined last week, if he will veto it or if he will sign it. So those are some things to watch as this plays out within the next month. Another thing to watch is whether or not Congress will now use the budget process to jumpstart its tax reform effort. Congress had planned to address healthcare reform via the budget reconciliation process. That process stalled last week, and Jen is going to talk about it more next. So they're reportedly considering if they will use that parliamentary process, the budget reconciliation process, for their next priority identified by the administration, which is tax reform.
Thanks, Nicole. So as Nicole mentioned, the American Health Care Act is the Republican-led effort to repeal and replace the ACA, or the PPACA, the Patient Protection and Affordable Care Act, that was passed several years ago under the Obama administration. While the overall fate of healthcare reform remains unclear right now, the AHCA had appeared stalled in its current form from last week after the passage vote was pulled from the House floor. So the expectation was that the focus for ACA reform would turn to HHS budget items and administrative action, which is an important piece. However, just yesterday, there is reported, kind of clamoring again from a number of GOP factions and some state officials, as well as some of the high-ranking Democrats, to put healthcare back on the agenda. So it's a little unclear right now how substantively this will affect that expected trajectory. One of the things we did want to mention is kind of what was in some of the important pieces that were in that American Health Care Act. So the bill sought to repeal individual mandates and replace it with continuous coverage policy. It also would have adjusted the tax subsidy structure to be on a sliding scale based on age versus income, but also with a cap on that. It would have delayed the Cadillac tax. The delay is due to some budget reconciliation rules. So if this bill would have passed the House, it would have then gone to the Senate. Some of the reconciliation rules on the Senate side would have forced that was the delay versus a full repeal. There was some rollback of Medicaid expansion. Two provisions that were kept from the ACA, they're very popular provisions, are coverage for pre-existing conditions and coverage for dependents up to the age of 26. Some of the sticking points were essential health benefits there were 10 essential health benefits laid out in the ACA, including maternity and newborn care and mental health services and addiction treatment. Also, in kind of that sticking points category are individual taxes and the Medicaid expansion. You may have heard, especially if you're in a state that did Medicaid expansion under the ACA, you may have heard a lot of your state officials' opinions on either side of that issue. So as we had mentioned earlier, that bill, the passage vote, was pulled from the House floor late Friday afternoon, and so that kind of appears that it needs to be either revamped or they will move to the next priority, which the administration has identified as tax reform. So kind of what is next for the healthcare world, and we can flip to the next slide. Thanks, Brian. Repeal Replace, we just talked about some of the other issues that have been mentioned, and for repeal replace is, so if this bill doesn't, if there isn't a comprehensive repeal and replace policy, we mentioned there will be a move to the administration, particularly around stabilizing the individual market, and there could be a lot of state action in that area. Specifically, the Tennessee senators, Senator Corker and Senator Alexander, have recently came out and said, there will be some issues within our state, and there are expected to be issues in other areas of the country around the stabilization of the individual market, and so states would drive or could drive and play a big part in that, in some of those emergency stabilization policies that would come up mid-year. Other issues that could be on the docket for healthcare is drug pricing. There is a bipartisan appetite for action there. MACR implementation. MACR was recently passed in the last couple of years, and so that has all moved to administration and implementation. We are expecting a provider-friendly environment and some flexibility around that MACR policy implementation, and are likely to see kind of some tweaks in what has been implemented and what would be said to be implemented in the future. Two other items which we will talk about on the next slide as well is CHIP reauthorization. So CHIP stands for the Children's Health Insurance Program, and the user fee agreements, which are also known as the UFAs. Those both need to be reauthorized by the end of this fiscal year. So if we flip to the next slide, the 2017 agenda for must-pass items. In the healthcare realm, it's, like I mentioned, the Children's Health Insurance Program and the extenders packages, as well as the UFAs, will need to be reauthorized by September 30th of this year, or some sort of extension would be needed there. The appropriations, Nicole talked about the budget on a couple of slides ago, and appropriations will need to be passed again by September, for fiscal year 2018 will need to be passed by September 30th of this year, or we could face another government shutdown there. On the non-healthcare side of things, the debt ceiling, which is more commonly known as kind of America's line of credit, is currently set at just under $20 trillion, is expected to be hit later this year. That deadline is a bit of a moving target, as it can be extended without congressional action by using some different accounting measures, but unless drastic action is taken, Congress and the administration will need to raise the debt ceiling and extend this line of credit in order to keep the government up and running. And as we mentioned a couple times, another threat to a government shutdown is the expiration of the current CR, which, as Nicole mentioned, is set for April 28th. We would need another CR or an appropriations package omnibus in place by then for either the next couple of months or for the rest of this fiscal year. Other priorities for the administration and for Congress, tax reform, it looks to be up next if the ACA is put on a back burner as that package is revamped. Drug pricing, and there is still a lot of movement around prescription drug abuse and opioid issues. So that's some of the issues that you should see coming up next from DC. And I will turn it over to Nicole to talk a little bit more about the advocacy update for NCPDP.
Thanks, Jen. So before we wrap up the webinar, I want to take a few minutes to talk about NCPDP's advocacy initiatives. As I mentioned earlier, the increase in the spending by the administration, or that the administration is seeking, to combat prescription drug abuse is a nod that this issue remains a priority for the White House. That's good news because it also remains NCPDP's #1 advocacy priority. To that end, we completed our first advocacy tour under this new administration just a few weeks ago, and I can report that it was a very successful trip. Our message continued to center around our PDMP model that will enable healthcare providers to deter prescription drug abuse and ensure access for patients with the valid medical need before a controlled substance is prescribed, using real-time alerts and responses. Since this was our first advocacy visit post-election, we also had several meetings for the purpose of level setting and providing a very basic overview of who we are at NCPDP and what our model entails. We continue to make big gains in educating policymakers, and that is the purpose of advocacy, is the education of policymakers and industry groups. We're continuing to see interest grow at both the federal and the state levels. Next slide, please. Our model was laid out based on recommendations that our real-time communication standards be utilized to improve the current PDMP systems. NCPDP has done a lot of work in this area and continues to do a lot of work. And I know that you will hear more updates from our task groups who are continuing to work on this model during our May work group. Next slide, please. So we knew from the start that we wouldn't be able to implement this model alone. While we can educate others on the significance that this model will potentially have on reducing the number of opioid overdoses, it is not in NCPDP's wheelhouse, so to speak, to actually implement the model. We need the help of the private sector and collaboration from the industry as a whole. So if you were in attendance at our February workgroup meetings, you heard during my update that we are beginning to see some of this come together. The reality is that we need the private sector to help move the needle forward. And when an entity comes to us and believes in the path that we've laid out in our white paper and offers to help provide a solution, we feel that we should explore that. And with that, I emphasize that NCPDP remains agnostic and that we will explore solutions with every entity that expresses an interest in helping us find a solution. We view this as a very important segment to improving patient care as it relates to ensuring the safe use of controlled substances and if opportunities exist beyond controlled substances as well. So we know that this model has a potential to continue moving forward. This model has a potential to secure sustainable funding options. The Cara bill, or the Comprehensive Addiction and Recovery Act, was another bipartisan bill that was signed into law last year. And if you do attend NCPDP workgroup meetings, you heard me talk a lot about this bill last year as well. It does include funding language, and it could provide funding for startup costs for this model. However, it doesn't promise a sustainable funding opportunity to continue operations. So with President Trump identifying additional funding that could be available in his budget outline for prescription drug abuse programs and for finding a solution to prescription drug abuse, that's a step in a good direction. That's a positive sign. And additionally, we are involved in ongoing discussions amongst the industry that are being held with agencies to identify potential other funding sources in addition to that. Next slide, please. So I guess to sum it up, what I'm trying to say is that this issue has momentum and it's a really exciting time for NCPDP. Just this week, there was an announcement that President Trump intends to release an executive order, it's expected later this week, that will create the White House Office of American Innovation, which among other things will also focus on combating opioid abuse. And former New Jersey Governor Chris Christie is expected to be tapped to be one of the leaders in this initiative. What we know is that the commission will involve 4 agencies, including HHS and the VA, and as many as 5 other members who are not federal employees. The Commission is expected to be tasked with determining best practices for prevention and recovery, evaluating federal programs and the U.S. health systems to identify regulatory barriers or ineffective initiatives, and also to make recommendations on changes to federal criminal law. The Commission will be expected to review its findings and publish a preliminary recommendation after 90 days with a full report expected to be issued a year after it begins its work. So those are forthcoming, something to look for this week, coming out in the form of an executive order that we'll be watching for and keeping you updated with more information as that comes out. And Jen is going to finish us up with what is occurring at the congressional level surrounding prescription drug abuse. Jen?
Thanks. So within Congress, we expect to continue to see prescription drug abuse remain a priority, specifically within these 3 buckets. The first is within the Medicaid debate, which could happen either within or outside of ACA repeal and replace. The second bucket would be the Cara and 21st Century Cures appropriations. The Cara bill and the 21st Century Cures bill that was passed late last year authorized a large amount of funding for different programs, provisions, offices, and agencies to combat the prescription drug and opioid abuse. However, it takes appropriations or action to actually get that money flowing. The authorization process in and of itself isn't enough. So that appropriations, that can happen anytime that an appropriations bill or package moves. So it could happen with the April 28th deadline or in the full year, fiscal year 2018 package that we would expect to see later this year. And then the third bucket would be the oversight authority that congressional committees have over the executive agencies, specifically within HHS, the Health and Human Services Department, the Department of Justice, where some of the money for prescription drug monitoring programs comes from right now, and the oversight authority for the FDA. So those are 3 buckets that I would keep an eye on, and we will keep an eye on, that they have proven to really care and about the prescription drug issues in the past, and we would expect that to continue through this year. So I think that is the end of the presentation. Brian, did we want to go through question or open it up to questions now?
Yeah. Just as a reminder, you can ask a question by typing your question into the question pane in the GoToWebinar toolbar. So feel free to enter a question. I'll go ahead and read it off, and Jen and Nicole will answer. All right, our first question today is it likely that money will be appropriated for a PDMP national network?
I can go ahead and start that one off, Nicole. I don't know if feel free to jump in or add to anything. The PDMP funding that is generally appropriated now is specifically for the improvement of state grants. However, state grant funding for the improvement of the state prescription drug monitoring programs. There hasn't, to my knowledge, been any money appropriated for a national network, though the national network or hub language did show up within the Cara legislation that was passed, as Nicole mentioned, last year. And so we are seeing kind of a shift towards the federal government or legislative intent wanting the money to go to states that in order for them to connect to something like a national hub or a national network. Nicole, do you have anything to add?
Yeah, just to tag on to what Jen laid out, I'm not sure if we'll see funding specifically lined out for a national PDMP network, but to that end, there are in the Cara bill priority grant considerations for states that would use a hub as the language that they use to share information. So indirectly, there's a line of funding right there.
All right, our next question is, what does the acronym MACRA stand for?
Sure, I will take that one. The MACR bill was a piece of legislation that was passed in order to, to permanently fix the sustainable growth rate that needed to be updated every year. So there are a lot of acronyms within that bill. It stands for the Medicare and CHIP Reauthorization Act.
All right, our next question is, if Congress is unable to repeal and replace ACA, how much substantial change would Secretary Price be able to accomplish via regulatory guidance?
I can start that one off too. When the ACA was originally passed, there was pretty broad authority given to the agencies to implement the policy via rules and regulations. So anything that was put through the rules and regulations process at the beginning, there would be standing that the current administration and the current secretary would be able to roll some of those things back. As I mentioned, we would expect a very provider-friendly rules and regulations coming out in as far as MACRA as well as the ACA. But I think it will still be determined, it's kind of still TBD, and they'll wait for some of the dust to settle and see where Congress is going with the repeal and replace before some of those rules and regulations start to come out.
Yeah, I think it's important to note too that there would have been, even if the ACHA or AHCA, the acronym, even if that bill, the healthcare reform bill, would have passed last year, there still would have been a lot that would have been left to Secretary Price to finish. Because Congress was using the budget reconciliation process, they were only going to be able to repeal provisions that had an effect on the budget. So, Jen covered that one of the sticking points and one of the things that was added at the very end in negotiations was repealing the essential health benefits. There was a question on whether or not that would pass Senate rules as to if that was even within their jurisdiction to address in a budget reconciliation process. So there are a lot of things that Secretary Price can still do, and he still, would have had a big job in front of him if that bill had passed, because a lot would have been left for him to do on the regulatory level as well.
All right, our next question is, will the slides from today's call be distributed to the attendees? The answer is yes. As soon as the call is concluded, I'll go ahead and send out the slides and the recording to everyone who participated. Right. If there are no more questions or comments, that concludes today's NCPDP webinar. I'd like to thank Nicole and Jennifer for your time and expertise today. And also, I'd like to thank all of you for your participation. Any final thoughts, Nicole or Jennifer?
Thank you everyone for taking time out of your day. If you have any additional questions, we're always here to answer them. There'll be a brief update during the May work group meetings again, I think, and if you are an ARCS Recon subscriber, the weekly newsletter will be a great source to continue to receive updates on what is happening as well.
And just to echo what Nicole said, my contact information is on that last slide. Please feel free to reach out if there are any other questions or comments. Thanks.
All right, thank you guys.
Thanks, Brian.